Question: how can diaphragmatic injury be differentiated from other injuries? Answer: diaphragmatic injury should be suspected in cases of significant trauma with signs of respiratory distress, abdominal pain, or abnormal physical examination findings. Question: what imaging studies are commonly used to diagnose diaphragm injury? Answer: imaging studies such as chest X-rays, computed tomography CT scans, or fluoroscopy can help diagnose diaphragm injuries and identify associated injuries. Question: what is the initial management approach for a patient with suspected diaphragm injury? Answer: the initial management approach includes stabilizing the patient, providing oxygen support, obtaining imaging studies, and addressing associated injuries. Question: what is the primary concern in managing diaphragm injuries? Answer: the primary concern is repairing the diaphragm, restoring normal respiratory function, and preventing complications such as bowel strangulation or herniation. Question: how does the management approach differ between traumatic diaphragmatic rupture and diaphragmatic hernia? Answer: traumatic diaphragmatic rupture often requires immediate surgical repair, while diaphragmatic hernias may have elective repair based on clinical stability and associated factors. Question: what are the indications for surgical intervention in diaphragm injuries? Answer: indications for surgical intervention include symptomatic diaphragmatic hernias, diaphragmatic ruptures causing respiratory distress, or concurrent injuries requiring surgery. Question: how is traumatic diaphragmatic rupture managed? Answer: traumatic diaphragmatic rupture is managed through surgical repair, involving suturing the diaphragm, or using mesh reinforcement, depending on the extent of the injury. Question: what is the role of laparoscopy in managing diaphragmatic injuries? Answer: laparoscopy allows for minimally invasive exploration, assessment, and repair of diaphragmatic injuries, leading to shorter recovery times. Question: how can the risk of postoperative pulmonary complications be managed after diaphragm injury repair? Answer: optimizing respiratory hygiene, providing appropriate pain control, and implementing early mobility help manage the risk of pulmonary complications. Question: what is the significance of diaphragmatic laceration in diaphragm injury cases? Answer: diaphragmatic laceration involves tears in the diaphragm tissue, which can lead to herniation or compromise of respiratory function. Question: how can the risk of bowel herniation be managed after diaphragm injury repair? Answer: ensuring proper diaphragmatic repair, addressing any associated bowel injury, and close monitoring help manage the risk of bowel herniation. Question: what is the role of chest tube placement in managing diaphragm injury complications? Answer: chest tube placement may be necessary to drain air or fluid from the pleural space, promoting lung re-expansion and preventing pneumothorax. Question: how can the risk of abdominal compartment syndrome be managed after diaphragm injury repair? Answer: monitoring for signs of abdominal compartment syndrome, decompressive measures, and addressing associated factors help manage this risk. Question: what is the significance of delayed diaphragmatic rupture after trauma? Answer: delayed diaphragmatic rupture can occur days to weeks after trauma. Early recognition, diagnostic imaging, and surgical repair are necessary. Question: how can the risk of infection be minimized in diaphragm injury management? Answer: administering antibiotics, practicing proper wound care, and addressing any signs of infection promptly help minimize the risk of infection. Question: what is the role of thoracotomy in managing complex diaphragm injuries? Answer: thoracotomy may be required in cases of extensive diaphragm injuries, allowing direct access to the diaphragm for repair or reconstruction. Question: how can the risk of recurrence be managed after diaphragm injury repair? Answer: proper diaphragmatic repair techniques, using mesh reinforcement when necessary, and regular surveillance help manage the risk of recurrence. Question: what is the significance of delayed diaphragmatic hernia in diaphragm injury cases? Answer: delayed diaphragmatic hernia can develop months to years after trauma. Surgical repair is often necessary to prevent complications. Question: how can the risk of respiratory compromise be managed after diaphragm injury repair? Answer: ensuring proper diaphragmatic repair, addressing associated lung injuries, and providing appropriate respiratory support help manage respiratory compromise. Question: what is the role of imaging-guided interventions in managing diaphragm injury? Complications? Answer: imaging-guided interventions, such as fluoroscopy or ultrasound, may be used to assess diaphragmatic function, position, and assist in repair. Question: how can the risk of diaphragmatic herniation-related bowel obstruction be managed? Answer: ensuring prompt recognition, addressing diaphragmatic hernia, and addressing any associated bowel obstruction help manage this risk.
Question: what is the significance of tension gastrophorax in diaphragm injury cases? Answer: tension gastrophorax involves stomach herniation into the chest with air trapping. Immediate intervention is necessary to relieve pressure and restore function. Question: how can the risk of hernia incarceration be managed after diaphragm injury repair? Answer: ensuring proper diaphragmatic repair, addressing any associated hernia, and monitoring for signs of incarceration help manage this risk. Question: what is the role of diaphragmatic plication in managing diaphragm injury complications? Answer: diaphragmatic plication involves suturing the diaphragm to improve function. It may be considered in cases of diaphragmatic injury-related respiratory compromise. Question: how can the risk of diaphragm injury-related gastrointestinal perforation be managed? Answer: prompt recognition, addressing diaphragmatic injury, and addressing any associated gastrointestinal perforation help manage this risk. Question: what is the significance of diaphragmatic injury-related subcutaneous emphysema? Answer: subcutaneous emphysema can develop as air leaks into the tissues. It may be managed conservatively, but underlying causes should be addressed. Question: how can the risk of diaphragmatic injury-related pleural effusion be managed? Answer: monitoring for pleural effusion, addressing diaphragmatic repair, and managing any ongoing leaks help manage the risk of pleural effusion. Question: what is the role of rehabilitation in managing diaphragm injury-related respiratory compromise? Answer: pulmonary rehabilitation helps optimize lung function, improve respiratory muscle strength, and enhance overall respiratory capacity. Question: how can the risk of diaphragmatic injury-related adhesions be managed? Answer: proper surgical techniques, minimizing tissue trauma, and using appropriate wound care help manage the risk of diaphragmatic injury-related adhesions. Question: what is the significance of diaphragmatic injury-related bowel strangulation? Answer: diaphragmatic injury-related bowel herniation can lead to bowel strangulation, causing ischemia and severe complications. Immediate intervention is required. Question: how can the risk of diaphragm injury-related pneumothorax be managed? Answer: monitoring for signs of pneumothorax, promptly addressing any air leaks, and managing chest tube placement help manage this risk. Question: what is the role of diaphragmatic injury repair in preventing long-term complications? Answer: proper diaphragmatic repair helps prevent complications such as respiratory compromise, herniation, or gastrointestinal dysfunction.
Question: what are the common mechanisms of diaphragmatic injury? Answer: diaphragmatic injuries can result from blunt trauma, penetrating injuries, surgical procedures, or other factors that cause direct damage to the diaphragm. Question: how are diaphragm injuries classified based on location? Answer: diaphragm injuries can be classified into three main categories: traumatic diaphragmatic, rupture, traumatic diaphragmatic hernia, and diaphragmatic laceration. Question: What are the clinical signs and symptoms of diaphragm injury? Answer. Clinical signs may include respiratory distress, abdominal pain, chest pain, subcutaneous emphysema, decreased breath sounds, and signs of bowel obstruction.